Good evening all. Today we are going to learn about fast hug BID in the ICU. So what is fast hug BID? To simplify the care of critically ill patient in the ICU, we have made a mnemonic so that we don't remember anything that we have to do to an acutely ill patient inside the ICU or anywhere in the hospital. So in the fast hug BD, each word stands for a critical step that you need to provide to the patient so that we expedite the patient's recovery. So F is for feeding or fluid therapy. Feeding can be given either through the Ryle's tube, that is the nasogastric tube or orogastric tube, or fluid therapy in the form of IV fluids. So the patient should have both feeding through the Ryle's tube or fluid therapy simultaneously, or either one of the way based on the patient's situation. So feeding can be given through the nasogastric tube or the orogastric tube, or in a conscious oriented patient with no contraindications for swallowing, you can give it through the mouth. The goal is to give minimum 25 kilocalories per kg body weight to the patient, and when the gut is functional and available without any contraindication, always use the gut for feeding. So in the feeding, the most important thing that you need to understand is the volume of the feed. So the volume of the feed for 24 hours should match the caloric requirement of the patient, which is 25 kilocalories per kg body weight. You have to make sure the dietitian charts a plan along with the critical care physician for that particular patient based on the patient's metabolic requirement. As in, if the patient is having fever, he will require more calories. If the patient is in catabolic state, for example, he is recovering from post-operatively from a surgery or a major viral or a bacterial infection, he will have calorie requirement. So he will be requiring at least 25 to 30 kilocalories per kg body weight. So you have to make sure that we give that feeding to that patient. If the patient's gut is not usable, you have to consider total parenteral nutrition. So total parenteral nutrition comes in central and peripheral forms, which the dietitian and intensivist prescribe. So it is very important that you remember that the patient should be feeding in the ICU or in the acute area, unless there are nil by mouth orders clearly directed by the admitting physician or ICU physician.